Hi, I'm Dr. Imaze Marian Davis. Welcome to my practice. And today we're taking care of a post-op surgical patient who had debridement of these wounds here. If you come a little bit closer, you can look at the wounds. So let's talk about what type of wound this is. This wound was actually caused by sunburn. The patient spent some time underneath the sun on the beach and ended up having large blisters that ended up draining while in the shower. That blister caused the superficial layer of the skin to be denuded. We have a situation where this patient has, history of having swelling in the legs. Okay, this is also a diabetic type of wound, but caused by sunburn, which is actually very common. So with this wound, the patient presented with this wound. We took care of it in the clinic, but we sent the patient to the hospital for antibiotic management, for debridement, and this patient's wound received a skin substitute, which you can see right here. The skin substitute was applied, adaptic was covered, and then the substitute was stapled down. You can see that both legs, foot and ankle area, as well as the tip of the toes was affected. Okay, so now the patient is following up right after surgery. It's only been a couple of days, and the wound is going to be hydrated with a product called Lavior Diabetic Wound Hydrogel. So this product here is great for hydration of the skin graft. So we're going to go ahead. You can place it directly on, just as you see. Okay, so instead of maybe your traditional wet to dry gauze, you can rely on hydrating this wound completely with the hydrogel. And if you have excess, don't worry, because this product is actually very good for eczema and for xerosis of the skin. So you can just rub it on the neighboring skin. So typically after a skin graft application and you put your secondary contact dressing, non-adherence dressing, you put in your hydrogel, your Lavior hydrogel, and then you can cover it with some gauze. And in this case, I'm just going to use an ABD pad for protection. So now, because this patient also suffers from swelling, from edema, or as we like to say, venous insufficiency, just going to add another dressing here. I'm going to go ahead and apply a 2-layer compression dressing to keep the swelling down. And this also allows the graft to have direct contact with the wound base.